And I invite Dr. Charu Rajendran, consultant ophthalmologist at Vettamai Hospital, Malanturthi, to talk regarding bridging the gaps in patient interaction.
I'll be talking about smart communication. It's a soft skill which is really required for a smart hospital practice. So what we are actually trying to do is communicate as much information as possible to the patient with as little time as we can get. So something that what I'm going to do in the next 12 minutes. So what are we targeting, or what are we wanting to achieve with trying to do or improve this patient-doctor interaction or communication? The first thing is we want to increase our approachability. Nowadays, patients have a lot of options. They have a lot of hospitals. So what we want to do is give them a good first impression so that they would want to come back to us. So be warm and welcoming, giving them a comfort and ease to interact with us so that they feel like they are okay and in reliable hands. That's approachability. Second thing is reliability. We want them to feel that we are a reliable source of information, that we will not take them for a ride, that they can trust us, and that we have their best interests in our minds. And third thing is accessibility. Something like, we just give a glass prescription and leave the patient, or we just give a drug and ask them to put it for 1 week and that's it. But following them up and saying that, see, this glass prescription will change in the next 2 years because it's presbyopic, it'll increase. So after 2 years, you can just come in and we can recheck and give you the new. So that followability, the fact that the patient feels that, okay, whatever, if I have any issue with it, I can always come back. So that accessibility, that's important. So what are the different modes of communication in a hospital? First thing is verbal, which is very obvious. Second thing is written. So if we have a smart hospital practice, you want to reduce the waiting time of patients who are in the waiting room, but you want to give enough chair time to the patient who is inside your cabin. So what you want to do is give them as much information. So if I have, say, most common diagnosis we have in OPD, conjunctivitis, you want to tell the patient the modes of transmission. You want to educate them regarding the fact that they need to take care of certain complications like, corneal SPKs and all that stuff. They need to come in for follow-up. But there's a limited amount of time, and you need to do this for every conjunctivitis patient. So if you have written pamphlets for these, you hand over the patient the pamphlet, you tell them that please go through it. And after you go through it, you can come back to me and ask any doubts you have. You can clear it with me. In the meantime, you can get the medicines from the pharmacy. And at that time, you can cater to another patient. So this is the smart hospital practice we are talking about. And then you have non-verbal. So what is non-verbal? We don't give enough stress to non-verbal mode of communication. You have to understand that only 7% of the words that we actually speak is communicating what we want to communicate to the patient. 38% of it comes through the tone of voice. So if you're saying, please come in after 5 days. So just saying it is not the thing. It's just like a written typed message. But when you have that tone of voice, a voice message, it gives you much more information. You know that, the doctor is really stressing on the fact that I should be there within 5 days or after 5 days. So that means that the doctor wants to see me. And then our body language, how we communicate it to the patient. So first thing is eye contact. Eye contact can establish a lot of things. You can, it shows the respect that you have towards the patient who's sitting in front of you. The fact that you are interested in listening to what the patient wants to talk. And also the fact that you are confident in the treatment that you're giving, or you're confident in what you're talking. So instead of looking elsewhere, look directly into the patient's eye and talk to them. Second thing is facial expression. How you hold yourself in front of the patient. Are you having a welcoming smile or a pleasant face? Or are you having a frustrated, exhausted? The thing is, by the end of the day, yes, you will be exhausted, you will be frustrated because you have seen so many patients. For that patient, you are the one doctor. So you have to be pleasant and approachable to even that 100th patient who comes to the hospital. Then the gestures, are you having a respectable, gesture? Are you having an intimidating gesture? or even your posture. Are you having a laid back or relaxed posture, or are you having a more alert and upright posture? That all of this actually communicates a lot of things to that patient with just, your non-verbal communication. Going to the verbal communication, address each patient by name. This actually helps in two ways. One thing is it minimizes errors. You may be having another patient's file open, but another patient may be coming in. And so when you say, okay, Charu, Rajendran, and they will say, no, I'm Sophie. Okay. Immediately you say, I'm sorry, I'll take the next file, open that patient's file and treat the patient, and then get to the staff and ask what happened, what was the mishap. This patient was next in line, but then you send in another patient. So this way, it minimizes errors. Second thing is that it also helps in the patient feeling like it's like a welcome gesture. You're addressing them by name, they also feel happy that you've called them by name. Second thing is instruct them properly while examining them, because most of them, they have come to the hospital for the first time. They don't know how to position themselves, where to look when they are being examined. So that also is important. Explaining the nature of the disease or the problem at hand, using words which are very simple for them to understand. Explain what are the options for treatment that they have, and explain what the patient can do to minimize That's important, because when you educate the patient, that they themselves can understand what they can do to minimize complications. Then, whatever concerns they have, try to give it in small bits of information like ask and tell. Let them ask the questions and you tell them the answers to that. Reassure them that we are always available whenever they need us, and ask them if they are better on follow-up. This will help in two ways. If you ask the patient if they are better, they feel like we are asking them a feedback regarding our treatment, so that the patient will feel happy about it. Second thing is that we may have not seen the patient on the first visit. So we also get to know whether the first visit they have improved or whether they are not improved. In that case, are we missing out something, or does the patient need more reassurance? Then never trivialize their symptoms, and sometimes you need to scare the patients if the patient is not compliant with the medications and you know the complications. You may have to just tell them, be more firm with them. Active listening, definitely listening to what they have to say without interrupting them in between, but asking them open-ended questions in between so that you clear your doubts as well. Empathize with their situation and understanding their concerns, putting yourself in their shoes and understanding what it is that is troubling them. The certain mental gymnastics we have to do as doctors is, we have to first assess the patient's socioeconomic background, educational background, to understand how much of information they may already be having. And cater to their...
Charu, can you please conclude?
Okay, so we have to cater to their level in order to